Good day everyone, I am Dr. Mohd Sadiq Azam and I am a consultant cardiologist from Hyderabad. In today's video, we will discuss about what is coronary angiography. Very often, when I advise an angiogram to a patient, the first question the patient asks is, Doctor, is it necessary? Can I be treated only with medicines? So here you have to understand that very often patients feel angiogram is a treatment. So can it be avoided and we can just take medicines instead? You have to understand that angiogram is not a treatment. Angiogram is a test. So what happens in an angiogram? In an angiogram, basically, now you have your heart. Surrounding your heart, you have blood vessels. The heart contains blood, the blood vessels also contain blood. So if I take an X-ray, I will not be able to see the blood vessels because there is blood everywhere. So what happens in an angiogram is that we give a special liquid into the blood vessel known as a dye. Now this dye contains something called a contrast media. So when I take an X-ray, after giving this dye, I am able to see the blood vessels well outlined, and then this will tell me whether there is a blockage in your blood vessel or whether your blood vessels are normal. Now this test is known as an angiogram. Very often, nowadays with the advent of WhatsApp and everything, everybody wants to get a CT angiogram. So what is a CT angiogram? Can everybody go for a CT angiogram? Is it recommended? Is it a useless test? Is it a useful test? What is the actual thing behind it? Now, a CT and an angiogram is basically a test where you are seeing the blood vessels of the heart. Now, this can be done in two ways. The conventional way is where you put a catheter which is around 1 millimeter, not 1 centimeter, 1 millimeter in size from your artery in the hand. It is passed into the heart and the dye is injected directly into the blood vessel and X-ray is taken to see whether there are blocks or not. At the end of the angiogram, we will be able to tell you whether there are blockages, if so, how severe it is and what further plan. The second thing is, in a CT angiogram, the same thing is done, but you don't pass a catheter into the heart. Instead, you put a venflon. That is, you put, like if you go to take blood, you take a IV fluid when you are sick, you put a venflon, a cannula. Similarly, a cannula is put and a dye is injected and an X-ray is taken. Both the tests will give us the same result. Now, when do you advocate a CT angiogram? No, CT angiogram is a non-invasive test. So that is generally used as a screening tool. For example, if I don't have any risk factors, my ECG is normal, echo is normal, I am having some vague symptoms, my doctor wants to know whether this is related to the heart or not. So he might advise me to go for a CT angio. So I go for a CT angio, the CT angio comes normal. Then I will not need a regular angiogram. But suppose I have already had a heart attack, then the chances of me having a blockage is very high. So in such a case, my doctor will advise me to go for a regular angiogram, because if I do a CT angiogram, for sure I will find a blockage in that. Then I will have to go for a regular angiogram again. So that means the dye that was given to me in a CT angio will again be given to me in a regular angio. That means double exposure to dye. So that is why in patients who have a very high suspicion of heart disease, or patients who have had a heart attack, or patients who are having a lot of risk factors for heart disease, or patients who are diabetic whose kidneys are already at risk, we don't go for a CT angio, we go for a conventional or a regular angio so that we avoid a double test. Whereas in patients who have a lesser probability of heart disease, a lower probability of heart disease, in whom you're doing it as a screening tool, a CT angio is good enough, because if your CT angio is negative, then you might not need a regular angio. So why is an angiogram really necessary? An angiogram tells us, firstly, whether or not there is a block in your blood vessels. Second thing, if there is a block, how severe it is. Generally, if the blockage is anything less than 70%, you do not need anything other than medications. If you have multiple blocks but all of them are only 50-60%, you will do well on medications alone. You don't need a stent or bypass or anything. If you have a blockage more than 70%, then you have an option of having various other treatments. Now, many patients feel that immediately as soon as angiogram is done, you have to go and do a stent at the same sitting. This is not always true. This holds good only in an acute heart attack where the blood vessel is 100% closed and you have to open it to save the muscle. At that time, there is no option but to open the vessel. But if you are going for an elective angio or a planned procedure, you can always do the angiogram, then take the CD, take a second opinion if you want, and then decide what you want to do. Your doctor will tell you his advice, but you can always, I always encourage my patients, if they want to take a second opinion, go take a second opinion and then come back to me and then decide what you want to do. So there are options. So an angiogram is not a treatment, it is a test. It's a test which helps us to plan your treatment appropriately. So don't be afraid of it and don't try to, find alternatives to it just because your doctor has advised you for an angiogram.